America, land of the free, home of the brave, and currently, a place where millions are about to lose their health insurance. That's right, folks, we're talking about the Medicaid freeze. It's a mouthful, I know, but trust me, its impact is even bigger than its name. So, what is this freeze, you ask? In a nutshell, it means the government is hitting pause on Medicaid enrollments. That means no new folks can sign up even if they desperately need it. And let me tell you, a lot of people desperately need it. We're talking about low-income families, people with disabilities, children, and seniors, all relying on Medicaid to stay healthy. Now they're facing a terrifying reality: no insurance, no access to healthcare. It's a recipe for disaster, and it's happening right under our noses. This isn't just about numbers on a spreadsheet, it's about real people's lives. People like Sarah, a single mom working 2 jobs, who relies on Medicaid to afford her son's asthma medication. Or John, a disabled veteran who depends on the program for his essential medications. These are just 2 stories out of millions. Remember Sarah, the single mom we talked about? She's not just a hypothetical example. She represents millions of hardworking Americans struggling to make ends meet. The Medicaid freeze throws a wrench into their already precarious lives, forcing them to choose between putting food on the table and getting the health care they desperately need. And what about John, the veteran who served our country with honor? He's now facing a different battle, one against a system that seems to have forgotten its promise to care for those who served. The Medicaid freeze is a slap in the face to veterans like John, who deserve our unwavering support. The impact of this freeze is far-reaching, affecting children who need regular checkups and seniors who rely on Medicaid for long-term care. These are the most vulnerable members of our society, and they're being left out in the cold by this heartless policy. Imagine being a parent who can't afford their child's medication because of this freeze. Imagine being a senior citizen who has to choose between paying for groceries or seeing a doctor. These are the real-life consequences of this policy, consequences that will have devastating effects on millions of Americans. So why the freeze? Well, the government says it's about saving money. They argue that Medicaid is too expensive and we need to tighten our belts. But here's the thing, cutting healthcare for the most vulnerable isn't saving money. It's just shifting the burden. When people can't afford healthcare, they delay seeking treatment until it becomes an emergency. This leads to more expensive hospital visits and, in some cases, preventable deaths. So, while the government might save a few bucks in the short term, they're setting us up for a much bigger financial headache down the road. But it's not just about the money, it's about priorities. When did we become a country that turns its back on the sick, the elderly, and the poor? When did we decide that healthcare is a privilege, not a right? The Medicaid freeze is a symptom of a much larger problem, a broken healthcare system that prioritizes profits over people. It's time we demand better, not just for ourselves, but for our neighbors, our friends, and our families. The Medicaid freeze hasn't gone unnoticed. People are angry, and they're making their voices heard. Protests have erupted across the country, with citizens demanding an end to this cruel policy. Social media is buzzing with the hashtag #MedicaidFreeze, with people sharing their stories and expressing their outrage. News outlets are covering the story extensively, highlighting the devastating impact of this policy on real people. Experts are weighing in, condemning the freeze as a short-sighted and harmful measure that will have far-reaching consequences. However, not everyone is opposed to the freeze. Some argue that Medicaid is unsustainable in its current form and that reforms are necessary to ensure its long-term viability. They point to the rising costs of healthcare and the need for fiscal responsibility. This division highlights the deep-seated ideological differences surrounding healthcare in America. It's a complex issue with no easy answers, but one thing is clear: the Medicaid freeze has ignited a national conversation about the state of healthcare in our country, a conversation that is long overdue. Section 5. Expert Opinions: Navigating the Medicaid Maze. Experts in healthcare policy and economics are sounding the alarm, warning of the dire consequences of the Medicaid freeze. They argue that this policy will not only harm individuals and families, but also have a ripple effect on the entire healthcare system. Dr. Emily Chen, a leading healthcare economist, warns that the Medicaid freeze will lead to increased uncompensated care costs for hospitals, which will ultimately be passed on to consumers in the form of higher premiums and out-of-pocket costs. Furthermore, the freeze is expected to exacerbate existing healthcare disparities, disproportionately impacting minority communities and rural areas, where access to healthcare is already limited. This will further widen the gap between the haves and have-nots when it comes to healthcare access. Experts suggest that instead of resorting to drastic measures like the Medicaid freeze, policymakers should focus on long-term solutions to address the rising costs of healthcare, such as negotiating lower drug prices and investing in preventative care. Section 6. Finding a solution, a path forward for healthcare. The Medicaid freeze has exposed the cracks in our healthcare system, but it's not too late to find a better way forward. Instead of cutting off access to care for millions, we need to explore solutions that prioritize both fiscal responsibility and compassion. One promising avenue is expanding Medicaid eligibility, not restricting it. By covering more Americans, we can spread the cost of healthcare more broadly, making it more affordable for everyone. This would also reduce the number of uninsured individuals, leading to a healthier and more productive workforce. Another crucial step is addressing the root causes of rising healthcare costs, such as exorbitant drug prices and administrative inefficiencies. By negotiating lower drug prices and streamlining the healthcare system, we can make healthcare more affordable without sacrificing quality. Ultimately, finding a solution to the healthcare crisis requires a bipartisan effort and a commitment to putting people before profits. We need to move beyond partisan gridlock and work together to create a healthcare system that is both fiscally sustainable and morally just. Section 7. What you can do. Be informed, be empowered. The Medicaid freeze might seem like a done deal, but don't despair. There's still time to make a difference. The first step is to stay informed. Read up on the issue, follow reliable news sources, and pay attention to how this policy is being debated in your community. Knowledge is power, and the more you know about the Medicaid freeze, the better equipped you'll be to advocate for yourself and others. Share what you've learned with your friends, family, and social networks. Spread awareness about the issue and its potential impact. Contact your elected officials and let them know how you feel about the Medicaid freeze. Make your voice heard and demand that they prioritize healthcare for all Americans. Remember, they work for you, and your voice matters. Section 8. A call to action. Raise your voice for healthcare. The Medicaid freeze is a wake-up call, a stark reminder that healthcare is not a guaranteed right in this country. It's time to stand up and fight for what's right. We can't afford to stay silent while millions of Americans are denied access to essential healthcare. Join rallies and protests, write letters to the editor, and engage in constructive dialogue with your elected officials. Let them know that healthcare is not a privilege. It's a fundamental human right that should be accessible to everyone, regardless of their income or background. Support organizations that are working tirelessly to protect healthcare access for all Americans. Donate your time, money, or resources to help them continue their vital work. Every little bit helps in the fight for healthcare justice. Section 9. The future of healthcare. A time for unity and action. The Medicaid freeze has brought the issue of healthcare to the forefront of our national conversation. It's a defining moment, a time for us to decide what kind of country we want to be. Will we be a nation that turns its back on the most vulnerable among us, or will we choose compassion and solidarity? The future of healthcare in America depends on the choices we make today. Let's choose to build a healthcare system that is just, equitable, and accessible to all. Let's choose to invest in the well-being of our citizens and create a brighter future for generations to come. This is not just about healthcare, it's about who we are as a society. It's about our values, our priorities, and our commitment to the common good. Let's rise to this challenge together and demand a healthcare system that works for everyone.